video is to discuss uh, various things that providers will do at the Saginaw VA clinic to a Saginaw Department of Veterans Affairs uh, medical center, not the VA clinic. That's actually in the annex, and it's mental health, but the medical side of the Saginaw VA. Now you have to check your discharge notes and your doctor's comments and such after you go there, because sometimes they'll put things in the record to try to not only sabotage your claim if yet you ever do one, but also to kind of diminish whatever your medical problem is. So if you go to another provider or the next provider when you go back, um, it makes their diagnosis of you more difficult. And sometimes the more malicious providers, they'll put notes in there to actually sabotage even the scientific findings. For example, if you do a pulmonary function test, to test for asthma or lung disease or a problem with your lungs or your breathing, there's a there's a calculation called your FEV1, which is full exhale volume on 1 second. And then you have your FCV, which is full capacitive volume, which is how much your lungs can hold. And there's a calculation to give them a percentage which tells them if your lungs are normal or not. Now, generally, if you do this test and your score is a 0.70 or more, you have normal capacity. If it's anything below 0.70, which is 70%, you don't. You should be able to fully exhale all the air in your lungs to a level of almost 70% in 1 second. So if it's below that 0.70, there's a problem with your lungs or with your breathing. It could also be a problem with your diaphragm or with your airway. So a doctor will test you, and if they put a comment after they test you, like FEV over FCV is 0.60, and then they'll put down their normal capacitive possibility or normal capacitive function. What they're trying to do is almost contradict what the science says. Now, the argument, this is where it becomes really even more muddy. Now, sometimes things change as people age, but it can't be estimated. If people try to estimate and make a comment like, oh, that's normal for someone's age, that's where they're trying to put something in your record and try to make a comment about your health that's not scientific at all. It's opinion. Because there's no, science can't demonstrate what is abnormal for a particular person's age or a particular person's um, medical condition, what their lung capacity should be. So you have to be careful with those comments in there when people put comments like normal for age or normal capacitive volume considering obstruction, you know, because they try to really word things that later will hurt the patient. Because as I've said many, many times, there's a lot of provider at this VA that they like to muddy the water and they don't care about their patients. This is the worst VA I have ever seen. And, it's sad that some of the people from where I grew up, there's a couple of people who work at this VA and that are silent about this. It's really, it's really disconcerting. And anyway. But so just check your records for comments like that. Another such comment will be patient comes into urgent care. This is just another example I heard. Patient comes into urgent care for airway and swallowing distress. So the doctor will, do an exam and look at the patient. The doctor writes, uh, they write patient evaluated and throat scoped and uh, provider found no visible pathology to airway or to esophagus. Possible anxiety um, or panic disorder noted as possibility. What they're saying there is that they think that you have some kind of mental illness, a panic disorder, or anxiety that's causing you to have airway and swallowing problems. Now, the problem lies in the fact that all they did is look at your airway. There was no imaging done to see if there's a lump somewhere along your throat or your esophagus or your trachea. There's there was no scoping of your throat. They just looked. A scope sometimes recognizes things like damage to the lining, or it can even notice if you have what do they call it, um, acid reflux, which erodes the lining and causes problems like narrowing because of the acid spraying up and the vapors. Um, let's see what else. Uh, Maybe you could have a problem with your muscles, like a lump or a tumor in your muscles that are causing them when you swallow to bump the lining of your throat, making an obstruction that is only there a moment, then it goes away. So there's lots of other stuff there that this provider did not do. And so they made a hasty diagnosis that, potentially could, if the person has cancer or they have a tumor or even acid reflux can sometimes turn into cancer if it's untreated. And besides ulcers and stuff like that, and besides perforation of the esophagus, it could cause a lot of other problems. So this provider has muddied the water again for this patient. It's these kind of comments that they put in there without proper investigation that are irresponsible. And if the veteran decides someday that they want to do a claim, it makes it more difficult for the claim examiner and for specialists. Specialists will have to say, well, all right, they didn't see anything but other stuff they didn't look at, but yet I don't know. It could be I'm not I'm not a psychologist. I'm not a psychiatrist. I'm an ENT. So I don't know. I think they should probably go see a psychologist too, and then more money is spent in addition to that specialist delaying your care because they have to defer to another specialist just to make sure um, you know that they're not wrong or they're not wasting their time and money because there's not going to be anything there. Or they could go forward thinking, well, they can go to psychologists that they want, but I'm still going to go forward and evaluate this patient. It depends on the type of personality of the specialist if they're going to do that. So a tiger, a tiger specialist, a shark, somebody who's like, I don't care what this provider said, something's going on there. I'm going to find out what. Sharks will always serve their patients well, but you don't always find sharks around this area, uh, especially dealing with the Saginaw VA. You tend to find a lot more predatorial stuff. And I heard another example of somebody went to see a respiratory therapist, and while they were doing their testing, the respiratory therapist said in the notes during second PFT testing after while performing FEV1 procedure, which they're doing exhale volume, a patient had asthma attack. Given corticosteroids, therapy partially assistive, and then under down there it put in remarks, uh, patient appeared to be partially helped by inhalation therapy. Results of exhale volume uh, poorly presented, poor inspiratory effort. Comment like that sounds like the they believe that because an asthma attack happened, the patient wasn't trying to breathe. That's what it says, basically. Patient had poor inspiratory effort means they weren't trying to breathe after an asthma attack. It's stuff like that. When people read it, they pass it on to the patient, and it's almost like they're trying to contradict the event that took place. The scientific finding was the patient didn't complete the full exhale volume in 1 second. They had an asthma attack, so it was disrupted. But they're trying to contradict that by saying, "Oh, just because an asthma attack, they didn't breathe, they didn't want to breathe, or they didn't try to breathe." Instead of saying something, this would be the objective saying, "Poor exhalation presented because of patient asthma attack." That's that's how you would word things to not patient shame. Uh, so you just read your records and be very careful because the more malicious providers there, they'll put notes like that. Which, if you're a ratings examiner, that's a nightmare because you have the science here, but then you have a professional making a subtle comment here. So for the ratings examiner, they're going to have to. It depends on their personality. A lot of this you'll find with different kinds of predators. And yes, I will say predator. A predator is somebody who hunts to harm or maim or use another person. And I've said this in many of my videos. There's many kinds of predators. And from what I've found in this community, and throughout Michigan, something is going on here when we seem to be attracting to the state a lot more than just, sexual predators because of a SORA lawsuit. Uh, Something is going on here. Just, you're seeing predators in other areas too. Um, and, for those of you out there that are defund the police types, in my experience, the past 8 years doing our investigation, we have found that it's not in law enforcement. I'm not saying there's not. There's some police that obviously their politics and their attitudes about race or religion, they control their police work and how they approach the public and how they approach crime. And I've seen both sides. So before people point the finger, I've seen both sides. I've seen police that are hesitant to do anything because of somebody's race and the blowback that will happen against them. And then I've seen others that, because of somebody's race or religion, they watch for somebody to mess up. That way they can, you know, uh, correct them or even detain them. So I've seen both sides. But I haven't found police. I'm not saying that we've met several people that I think should not be wearing a badge in our 8 years. Several, but we found more predatorial behavior amongst agencies and amongst people who live and work around. mid-Michigan, and you know, and we'll find it's just interesting to note that when we encounter these people doing like maybe slowly stealing from their company by having their friends come in and damage food, that way they can write it off and then throw it away, but really they're taking it home. Or people tamper with food, tamper with meat, that way, oh yeah, all this meat every month we're throwing away 50 pounds of old chicken because it's been thawed more than once, or the plastic has been ripped, stuff like that. Yeah, we had to write it all off. We just take it out the back door, and then either employees take it, or if nobody takes it, we send it to a homeless shelter or something like that, or or just destroy it. It's just stuff like that. Or we've encountered social workers who wanted to, which interestingly, this particular situation was at the VA, which is very problematic. But social workers that work in various programs to help homeless veterans, and they try to convince the veteran to make them their legal representative or give them power of attorney during their disability process. You know, this is somebody who works for the VA, is a social worker in some capacity, and they're asking their client to make them basically their guardian. It's crazy. But there's other places, people who maybe work for something like Michigan Works. It's supposed to help people, find jobs, get involved with the talent bank, get into training programs, whether it's education or voc tech or resume classes. This is their job. But when it comes to, you know, their uh, their communication and their program, the veterans being sabotaged in the program, you know, whether their paperwork is disappearing from the office, or their communication via email, with an instructor or something like that, is being hacked and being sabotaged. Or another example, they are they're being abused in the office, but the this particular, let's say, one person or two people at some place like Michigan Works, they refuse to report it to supervisors, or the supervisors refuse to do anything. Maybe a client is being treated abusively when they come for training or for job hunting or something. They're being treated abusively. They refuse to do anything about it. They may even join in and abuse somebody because maybe they're not that educated, or maybe they culturally they're from a very different part of the country, so they don't understand the cultural let's see, the cultural how could I describe this? The cultural behaviors of the Midwest. So people are actually being rude to them and abusive, but they don't see it because they're from a different part of the country. Let's say a place where politeness matters, even if you don't like the person. You're supposed to be polite and friendly, um, but they don't realize that they're being abused by people, and so the supervisor will join in. Uh, let's see, stuff like that. Let's see, what else have we seen? We've seen doctors or nurse providers that they would rather stack patients than listen to care. So if a person wants to take time to discuss their medical issues, they dismiss them. They'll say, "Oh, okay, yeah, next time. Well, we'll make another appointment for next week." Or they'll put in the notes, "Patient always wants to talk about many medical issues, uh, and doctor doesn't have time in 30 minutes to discuss every medical issue or answer questions." Patient advised to make longer appointment next week. Stuff like this. Um, it's predatory behavior. Because if you didn't notice that the doctor's trying to make more than the appointments that are needed, that way they can bill the insurance, bill the patient, or bill Medicaid and Medicare. There's plenty of inserts, and if doctors are reading medical histories in the beginning, about why the patient's coming, because generally, when you make an appointment, the schedulers will ask you what an appointment is for what purpose, so the doctor can be properly prepped. So if the doctor doesn't have enough time to address the things that the patient is there for, then they should have made a longer appointment to begin with. And there's plenty of brochures and information that can be given, or a phone consult. They can call in, and doctor can inform a nurse, yeah, this patient's going to call in later on, and they have some questions about this, this, and this. So, I want you to explain it to them and discuss it with them. We didn't have enough time. Instead of billing for another doctor's visit, which is that's the highest order of billing. A phone call, to your doctor's nurse or even their LPN, discussing items that the doctor puts on a list and what to tell the patient. This is more appropriate than billing again by making another appointment but longer. And these are all predatory behaviors that we've identified here. So you have to be aware when people are not giving you the care you deserve, they're not giving you the treatment you deserve, and they're trying to cover their tracks in remarks or in notes, because either they have a bad attitude or they're just a bad person. So be prepared and protect yourself.